Awesome. So I think we're still going to have some more people trickle in, but we will get started. I think I know most of you, but for those of you that don't know me, my name is Alicia Hasseltine. I am a physical therapist. I own Medicine by Movement, Wellness, and PT. Um, I offer traditional physical therapy services, but also a lot of wellness services. And one of my wellness services is a monthly wellness group, which some of my members are here. um, and with that, I incorporate guest speakers, and then every month I try and do some kind of workshop or talk. And so this month is menopause and perimenopause. Um, these are usually, I try and make them a little more interactive and get up and moving. This topic doesn't really lend to that. And there is a lot of information. I just finished a 6-week course on this. And so trying to condense it into less than an hour is going to be tricky. So I'm going to be throwing a lot of information out. Feel free to stay after, chat with me, ask questions. This is pretty informal, so you guys can pipe in whenever you want. I know there's other healthcare professionals joining. And so if anyone else has things they want to chime in with, please feel free. Um, if is needed, there are bathrooms over here, water fountain. You guys can get up and move. I don't like sitting for an hour, so I won't make you guys if you don't want to. Um, and then just two kind of important topics I want to discuss before we get going. The first one is this is a really exciting time um, for this topic in general. I think there's a lot of really new and exciting research out there. Um, and it's about time that we had this come to light. With that said, there's still a lot of gray areas. And so, if everything was cut and dry and it was clear, there would be recommendations of exactly what we should be doing. And unfortunately, we're not quite there yet. We're getting closer. There is some great research on like hormone replacement therapy for certain populations that is clear that it is helpful at this point, but that doesn't mean it's for everybody. Um, what is exciting, I think, is women have been very underrepresented in a lot of medical research, mostly because we're hard to track because we have hormones that go up and down, and so men are much easier to study, and so they get a lot more of the studies. And so um, something like, oh, say cholesterol. If you have high cholesterol, the first thing they're going to recommend is putting you on a statin drug. That lowers your cholesterol, which is true across the board, but women develop heart disease a lot different than men. And although it lowers our cholesterol, it doesn't change our mortality rate. And so um, we have more of a vascular disease where men lay this plaque down in the vessels. And so we should be treated differently than men. And until this point, we're kind of just little men. They just give us less of whatever they have thought. And so exactly. But this is an exciting time. So that if nothing else, I think is something that is coming to light. Um, for those of you that have done some research on like hormone replacement therapy and things, there was a study. Oh, they reviewed it in early 2000s. It was the Women's Health Initiative, and it looked at hormone replacement therapy. Their target audience was older, so most of them were in their 70s. It was only one hormone that was used, and unfortunately, there was this high risk of breast cancer. And so all of a sudden, everyone got off of it. Everyone was afraid. No one wanted to use it, and there was like this lull of, okay, that's not good. Since then, there's been a lot more studies that have come out, and for certain populations, so younger people, which we'll talk about, without certain family history, it can be very, very beneficial for certain things. Um, and so there is some clarity on some parts of that. It's just um, with this newer research, there's a lot of people out there saying well, every woman should be on it for preventative reasons. And unfortunately, that's not the case because we don't all need it. And there are still some side effects from it. So keep that in mind as we go forward. Um, the other thing is, real quick, I am not a physician nor a dietitian. We are going to talk about some things related to that. My expertise is movement and exercise. And so I have a fair amount of knowledge in some of these other topics that we'll discuss, but you should probably consult with your physician or healthcare provider if you are going forward with any of the recommendations. Okay, cool. So, everyone at home, hear me okay? Now that I said my whole spiel? Cool, thank you. All right, so 40% of our life is spent post-menopause for the average woman. That's almost half of your life. That was not the case 30, 40 years ago. We are living longer. And so I think it's really important that we learn about how our bodies function after that point in time. Um, 3 out of 4 women that seek help for perimenopause symptoms don't get it. And a lot of them that do get it are offered an antidepressant as opposed to anything else. 1 in 5 women will quit their jobs because of the impact of their mental health and brain fog, and that's 1 in 5 people. This is like, if you are a working female, this is probably the height of your career. You've put in your time, and so don't ignore these things. There are things that we can do now that address these. Okay. Um, so what is menopause? Uh, it is characterized by not having menstruation for 12 months. So you can go 9 months and then have a period and it starts all over again. So it's kind of a silly thing, but that's how it's characterized. It's one day that all of a sudden you turn the corner. Um, on a deeper level, it is the depletion of our ovarian reserve. Um, our FSH, or follicle stimulating hormones, increase and our estradiol or estrogen levels decrease. And I will explain that a little bit more here in a minute. Perimenopause, well, so the average age for this is somewhere between 45 and 52. Most people right around 50 to 52. Perimenopause starts 7 to 10 years prior to that. So if anyone here is 40 or above, and you have not gone through menopause yet, there's a good chance that you are having some perimenopause symptoms. And basically, it's the start of our estrogen decline and our hormones changing. And so, just a very quick um, layout of this. Your hormones are chemical receptors that are in your body. Okay. Some of the important ones are luteinizing hormone, follicle stimulating hormone, estradiol, and progesterone. I don't know if you guys have heard those terms before. They all go through the HPG axis loop, which is the hypothalamic, which is part of your brain, the pituitary glands, and then gonadal, or ovaries for women. Should change that name. This is basically a communication loop between all this. And so when your body is ready to let an egg go, the brain is going to say, hey, I want to let the egg go. And so it releases follicle stimulating hormone. And that goes to the pituitaries, it releases it, goes down to the ovaries. Then when the egg is ready to grow, it's going to release luteinizing hormone. And then the brain is saying, okay, we're ready to implant the egg, so we're going to release some estrogen and progesterone. And there's this loop that goes on. But in perimenopause, we start to get a critical egg supply. So when you're born, you have all of the eggs in your body that you're going to have. And as we get older, that supply gets less and less. And your brain is like, oh, there's not enough hormones. And so it increases the FSH, it increases these hormones, and you get like this huge influx of everything. And then it bottoms out. And so it's up and down and all over the place. And that's why we feel a little crazy. Um, and that continues until we reach menopause, and then things kind of flatten out a little bit. And after, if you are a woman that has gone through menopause, a male of the same age actually has more estrogen than you. So, um, yes, exactly. The reason this is important is estrogen is neuroprotective, meaning it fights inflammation, it fights changes to our body. It's one of our biggest protectors of our body. And so when that starts to go down, we have all kinds of things that happen. Um, it increases insulin sensitivity, it helps our bone health, our metabolism, our cardiovascular system, homeostasis of our body. Um, and something in particular called free radicals. I'm not going to get too far down this hole, but basically, this is an unpaired ion or atom in your body. And when these guys float around without estrogen there to protect it, they cause an inflammatory process and they can cause damage to the body. Um, because that insulin sensitivity is lower, it can't fight it off. And we aren't able to fight off diseases such as cancer and autoimmune issues and cardiovascular disease. Um, and so that's scary in itself. There are a lot of other things we can do that help this as well. So, physical activity, nutrition, decreasing exposure to pollution and stress, not smoking, not being overweight. These are all things that are helpful. We also release 5 free radical fighters within our body, and these guys are housed in your skeletal muscle. And so, any kind of exercise, weight training, or endurance exercise can actually increase these fighters that help to fight off the stuff. So, exercise is good. Um, you can also consume some in your diet, things like blueberries, anything really colorful fruits and vegetables tend to have a lot of this. Um, it's not shown to be quite as potent as the fighters within your body, but they're helpful as well. So that's a very quick, down and dirty part of what happens in the body. Um, so back to perimenopause. When we start to go through this, we have a lot of different symptoms. Pretty much anything you can think of, but abnormal periods, fatigue, sleep disruption. We lose resilience, meaning like we snap or are more irritable. Um, Vertigo, skin changes, gut changes, musculoskeletal pain, vasomotor symptoms like heart palpitations, anxiety, hot flashes, pelvic floor and vaginal changes, cardiovascular and bone changes. 2 in 5 females will get something called burning tongue syndrome, where their tongue burns for no reason. Brain fog is a huge one where you can't find the words. The good thing about this is it's temporary. It's a neuroreceptor shortage, and so once you go through menopause, that will return. So it's not like you automatically have dementia, but it can be very disabling. So the longer your body is away from estrogen, the earlier your cardiometabolic issues occur, which puts you more at risk for dying early, basically. So estrogen therapy, if you were to go that route, is needed early on. So for some of my population here, that's long gone, but for some of us, that's something to consider. Estrogen does much better at preventing disease than it does treating disease, meaning if you are in perimenopause and you have symptoms, taking that early on, so in your 40s, early 50s, is much more effective than trying to treat it when you get into your late 50s, early 60s. Does that make sense? So the years away from estrogen is really what matters. This is where things get a little gray. Like I said, there's a lot of people suggesting, well, why aren't we all on estrogen therapy then when it starts to decline? Not all of us have these symptoms, and there are still some risk factors associated with hormone replacement therapy. And so it's not for everyone. But if you have any of those symptoms we just talked about, and you don't have a history of breast cancer or ovarian cancer, it is certainly something you should talk to your doctor about. Okay. Um, if you don't want to go that route, and a lot of people don't, there are a lot of conservative things we can do to help this. And that's what we are going to talk about right now. So, um, outside of hormone replacement therapy, exercise, diet, sleep reduction, or stress reduction, and sleep, increased sleep. All of these things help. And so I want to kind of break it down for some of the main disease processes that we see and go through what that would look like. Um, so, cardiac issues, that's a big one as we go through menopause. You are at 2 to 4 times the risk of a cardiac event when your estrogen levels start to decline. Cardiovascular disease is the leading cause of death in women in the US. There's more deaths from cardiac issues in women than all forms of cancer combined. Okay. Um, and as I kind of touched on earlier, only about 40% of females are in these studies. And so we are being treated a lot differently than how we should be treated in this. And unfortunately, especially for women, this is a silent killer. So we don't often know what these factors are. Things that we should pay attention to see if we are at risk are things that change with age. So our fat composition changes. We start to get more of that visceral fat, the stomach fat, which is what puts us at more at risk. There used to be a gold standard of looking at BMIs to see if we're at risk. And really, at this point, looking at your hip waist ratio is a lot better indicator. And so you take a measurement at your skinniest point of your waist and then at the largest point of your hips rear end. Anything 0.8 or higher puts you at a higher risk. And so in this point, it's better to be like a pear shape as opposed to an apple shape. We want a thinner midsection. Okay. Waist circumference less than 35 inches is ideal as well.
Less than what?
35. No.
Never.
So this is a big thing because I don't know how many of you have experienced this, but you definitely start to develop fat laying down in different areas, and that visceral fat is a huge indicator. If you are over 55 years old and female, you're at risk. Family history, chronic kidney disease, hereditary dyslipidemia. So if you have a family history of high cholesterol, they say that you should start get your blood checked at age 21 and continue every few years just to see if that changes. History of hypertension, diabetes, obesity, autoimmune issues, so things like lupus and RA put you at a higher risk. Risk factors specific to women are postmenopause, hysterectomy, especially under 35 years old, even if you keep your ovaries, oral contraceptives, pregnancy complications. So if you had a preterm birth, intrauterine or vascular complications, preeclampsia, gestational diabetes, hypertension, lack of breastfeeding, all of this stuff puts us at a higher risk, where men don't have to worry about that. Endometriosis or early menopause, and if you started your period earlier than the age of 10. All of those things we don't have a whole lot of control over, but they're things to be aware of. Things we do have control over are smoking. So if you smoke, you triple your incidence of death. Drinking more than one alcoholic beverage per day on average increases your risk. A diet high in saturated fats. If you get less than 7 to 8 hours of sleep per night. Physical inactivity, and for cardiac stuff in particular, increasing your resistance training. So lifting exercises of 4 to 5 times a week is best for the heart. And then For women in particular, they've shown that cardiac rehab reduces your risk by 12 to 25%. This is way better than men. This is one positive thing for us. So we react well to physical activity. Um, this can be a hospital based program, but it can also just be a home program that an educated person takes you through. Um, Something that they've looked at a lot is HIIT training, so high intensity interval training. This is where you bump up to one of your heart rate maxes and come back down, and you go up and down um, at this high level of intensity and then back down to moderate. They have shown that there is no difference in fat distribution or lipid serum between that and just exercising, um, burning the same amount of calories, but you accomplish it in a less amount of time. And they're showing that you'll actually lose more of that abdominal visceral fat with HIIT training. So if you are in your perimenopause years or approaching that, that's something to consider. If you are, if you have osteoarthritis or things that may prevent you from doing some of that, walking is a great form of this. And they've shown that if you use walking sticks, we burn up to 46% more calories as opposed to just walking without sticks. So I know we talked about this in class the other day. Part of that is it increases your speed. Part of it is you're using your whole body. And then resistance training is huge. So it helps to control our insulin levels. It decreases our cholesterol, helps with weight loss. And so adding that into your regimen as well. 2/3 of women who die from heart disease had no previous symptoms. So like we talked about, it's a silent killer. There is, on your little handout I gave you guys, there's the ASCVD risk link. It's under the links. It is an app that you can use independently, and it assesses your 10-year risk for cardiovascular disease. So some of these things we just talked about, it walks you through that, and it gives you a better idea of if it's something that you guys should follow up on. Estrogen replacement is not helpful for treating heart disease. It can be helpful to help prevent it, especially if you have certain risk factors listed above and you don't have a history of breast cancer or ovarian cancer. Okay. How are we doing? It's a lot
I have a
of.
question.
Yes, please.
You mentioned resistance training. Do you also mean weight training, like lifting weights?
100%. Yes. And
Okay.
I'll touch on that a little bit more, but that's exactly what I mean. So any kind of resistance, it can be body weight, it can be weights, it can be bands, but yeah, for sure.
Okay, thank you. And you mentioned a handout. Will the distance folks get a handout too, or?
Yes, I will
Oh,
certainly.
okay.
Yep,
Thank you.
of course. Um, Neurological, this is a whole conversation in itself, and I'm not going to try and tackle that today, but know that estrogen is neuroprotective. So decline in estrogen also correlates to some mental health decline as well. Um, there's a lot of brand new research out there right now and a lot of debates over this right now. Some of the links on your handout, there's a couple podcasts that I just listened to one yesterday that was great on this topic, but just be aware that it does affect that, and hopefully in the next year we'll have a little more clarity on it. So bone health. This is another huge thing, osteoporosis. As we start to lose estrogen, we start to lose our bone. So osteoporosis is an imbalance between bone resorption and bone formation. And basically, if you were to look at your bone, it not only gets more brittle, but it kind of looks like Swiss cheese. You have all these holes and everything in it. And 90% of our bone mass is achieved by the age of 16 to 18 years old. So most of your bone is there as a child. 60 to 80% of that is genetically determined, but the rest of it has to do with Are you getting enough calcium and vitamin D? Are you doing impact activities? Are you making sure you're not amenorrheic when you shouldn't be? Things of that sort. Um, as we get older, 50% of Americans over the age of 50 are at risk for osteoporotic fracture. It's a lot. 10 to 12% bone loss during transition to menopause, secondary to the estrogen decrease. And then 1 year before you go through menopause, you have a really rapid decrease. And then after menopause, you continue to lose 0.5 to 1.5% every year, which is huge. um, a DEXA scan is kind of the gold standard to see where you're at with that. Anything minus 2.5 or below is considered osteoporotic. A little less than that is osteopenia. And then hopefully we're all good. They still recommend people to get a DEXA scan starting at age 65. But I would say there's some research out there. If you have some of these issues, or if you think that maybe between the ages of 16 to 18, you didn't get a good bone lay down, then I would say it's worth getting a DEXA scan earlier, because there are some things that you can do early to prevent some of this. Whereas if you wait until you're 65, 70 and you already are in osteoporosis, it's not nearly as effective. Other things that affect our bone are consuming soda or more than three glasses of alcohol per day, tobacco use, a sedentary lifestyle, heavy metal exposure, things like lead, endurance training or eating disorders that cause amenorrhea, vitamin D deficiency, poor nutrition. These all kind of contribute to our bone. We do need, no matter what, we need calcium paired with vitamin D to help maintain our bone and grow bone. We also need protein. And so the recommended amounts for bone health are 0.8 grams of protein per kilogram of body weight per day. That's a little different for what I'm going to talk about later, but for bone health, that's what they recommend. Micronutrients, so like vitamin K, has been shown to help reduce bone turnover. Magnesium is helpful. It's not directly related to bone health, but it helps like constipation issues and things related to calcium. Yeah. Oh, leafy greens. I have a whole handout on that I can send, that lists calcium, vitamin D, vitamin K, all of that good stuff.
And now they're making vitamin supplements.
Yeah. There's some studies that show that zinc is also helpful with bone remodeling. Hormone replacement therapy can be beneficial if you're under 60 years old, but not really recommended for after that. But a huge part of this is exercise. So exercise for bone health. If you are younger, if we're going into perimenopause or in perimenopause, even if you are in past menopause but do not have osteoporosis, any kind of weight-bearing activity, especially high weight-bearing, so plyometrics where you're jumping or running, high velocity, high load, so things that you move quickly, power training, resistance training, variability, meaning move in different directions as opposed to just in one plane of motion, posture and balance, and whole body vibration have all been shown to be very beneficial in maintaining and developing bone.
Whole body vibration.
Mm-hmm. So we're not going to talk too much about whole body vibration because we do not have anything in Sika that accomplishes this, but they have actual machines that you get on.
What about your bike?
Yes,
That's
perfect.
what we will play.
Yes. That would be a better alternative. They have some studies out there where you get on this like force plate that vibrates and you do all of your exercises on there. And the vibration actually shows to increase some hormone release and also helps to build bone. All right. Well, we can all go to Sharon's.
Upstairs, downstairs.
But yes, riding a bike on uneven ground, something that causes some vibration will have some extra. Danielle, it looks like you have a question.
Yeah, I put it into the chat, but I was just curious about why does soda in particular have an impact on bone density? Is that because of the carbonation that's in it, or is it just the fact that it's loaded with sugar?
Both. So any carbonated beverage pulls out some of the important parts that we need in our bones. So when we talk about like the vitamin K, the magnesium, that kind of stuff, it there's research out there that shows that it pulls some of that away from our bones. But sugar in general also impedes all this. And that's probably, to get more into that, I would say speaking to a dietitian would be able to answer that question in a lot more depth than what I can. But I know there's at least one study showing that even I think 2 carbonated beverages per week can actually affect your bone health.
So it's like the carbonation itself. It's kind of got that effect potentially.
Yes, and I mean the sugar definitely affects it as well, but I think it has more to do with the carbonation.
Okay. I'm just thinking about like all of those beverages that are out on the market now, like bubbly and LaCroix and things that are those carbonated seltzer waters that don't really have sugar in them, but that makes them very appealing as kind of like a healthy alternative. But now that's making me rethink that.
Yeah, does anyone here have any? They Yes. Yeah, so I don't know if you guys at home heard that, but the Huberman Lab podcast, which I will send you folks at home the links to that. They dive into some of those topics, and I wish I had a better answer for you, but I don't know all the specifics on it. I do know carbonation definitely affects it, though.
My daughter's a full back chiropractor, not to drink it.
Yeah. Yeah. I think, anything in moderation is fine, but if you are having a couple every day, that's probably something to reconsider. No 2 beers a day either. Does that answer your question, Danielle?
Yeah, thank you.
I mean, you could let the beer go flat and just see what happens. Okay, so in general, power training is superior in postmenopausal patients over just regular strength training, meaning lifting heavy loads more than just lifting is beneficial. And this gets a little convoluted because if you are new to exercise, I'm not going to tell you to go to the gym and lift a 5-rep max because you're going to hurt yourself. But the other handout you guys have, the introduction to exercise, kind of walks you through how you would start to increase that. And so let's say like a bicep curl. If you had a weight in your hand and you were to do a curl, you would grab a moderate size weight and you would see how many you could do. And so you need to be able to go through the full range of motion, meaning go all the way up and all the way down, and go until it gets fatigued, meaning you can't go more or you can't go as far. Now, if you only got 10 repetitions out of that, then you're close to where you should be for more high resistance training or power training. If you're upwards of like 35, that means you're going to slowly start increasing your weight until you get to a point where you can do like 6 to 8 repetitions, and we'll talk about this a little bit more down in a little bit. But when they say power training, it means introducing heavier loads and more impact. Okay. Resistance training, and this is kind of newer, resistance training is even more effective than weight bearing exercises for bone health. And so, even if you are getting in your walking and your weight bearing activities, you still want to make sure that you're getting in some resistance training at least 2 to 3 times a week. And resistance meaning going against a force. So, your body weight, weights at the gym, or bands, or something along those lines. Gravity can help. Yeah, yeah. In particular, because bone health, our four most common places to get a fracture are your lumbar spine, your hip, your wrist, and your ribs. And so, looking at studies that look at lumbar spine, doing any kind of back extensor exercises, so moving your back backwards, is very helpful. And things like Tai Chi, ballroom dancing for balance progressions, yoga, not only is it equally as effective for balance, but it decreases cortisol levels. It reduces the kyphosis in your back, so that rounding of your back, it can help with that. And depending on the type, can actually reduce bone resorption as well. If you have osteoporosis or the higher end of osteopenia, then we want to be a little more careful with those impact activities. So instead of running and jumping, you're going to do more walking or stair climbing. You still want to make sure that you're impacting your spine and your joints, but at a lesser level. You want to avoid spinal flexion, so bending forward, and rotation in ranges. And that doesn't mean forever. It doesn't mean you don't ever bend forward again, but you want to be careful with these and have someone guide you through to safely start to increase some of that. And then if you have osteoporosis, starting in slow and then progressing. So starting with 4 to 6 lower body weight training exercises is recommended, 30 to 60 minutes per day combined with aerobic activity. Okay. If you are trying to prevent osteoporosis, so this is like before you have osteopenia or osteoporosis, then that higher intensity, lower reps, so 5 to 6 repetitions, 2 to 3 times a week. So that's what I was talking about with that bicep curl. You're getting to a weight where you get to 6 repetitions and you feel like you can't do another one and go through the full range of motion once you've slowly progressed to that. If you have osteoporosis, then going at more of a moderate level, so 8 to 12 repetitions and more often, 3 to 5 times a day, is recommended. Be careful if you've had like a spinal fracture or a hip fracture, then the max amount of lifting you want to do is somewhere 5 to 20 pounds safely. They looked at a 12-week program of 3 times a week strengthening, and it reduced osteoporosis and actually showed that we made some gains, which this has been controversial in the past, but they said you can gain 1 to 3% is a realistic gain after we start to decline. You need adequate amount of vitamin D and calcium with the resistance training. And then they recommend introducing high impact, high intensity, dynamic, multi-directional, everything we just talked about. Yeah. So yes. And once again, this is something that is individualized. So I'm not going to say everybody should take a ton of vitamin D. You should talk to your doctor about that. But we here in beautiful, sunny Southeast Alaska should be taking more than the average person going through this process. For sure. And then, yeah, so that kind of is the overall for bone health. That's a lot of information really quick. Does that make sense to everyone? Yeah. So it can. When we get in, the question was in the water. When you get in the pool, it takes gravity out of the picture, so you're no longer weight bearing as much. And so if you were just doing the stuff for bone health, the pool would be one of the last places I would recommend going. But you can still have benefits of resistance training in the water. So if you have, say, osteoarthritis, if your joints don't tolerate doing things on land, there's still benefits of getting in the water and doing resistance training. You're just not going to have the added benefit of the weight bearing.
What about those floaty
Mhm. The
and
the barbells and
water
stuff.
ones?
Yeah. So the water is nice. The faster you move through it, the more resistance you have. So just like using gravity or body weight or bands or anything else, it is going to give you the benefits of some resistance training for sure. Danielle.
So on a lot of like kind of exercise apps and things like that are sort of like tracking your movements and how much activity, a lot of it's kind of arbitrary as far as like putting in your height and your weight and kind of what your sort of goals are, I guess, for hours of exercise. But there's also like MET hours, MET hours of exercise. In the setting of like perimenopause, I've read that it should be about 24 MET hours of exercise per week. Is that like fairly consistent to like current research standards, or is it more than that? Because I've also read in other areas, like Healthline had a thing of like, they had posted that you should have 500 MET hours of exercise per week. And I'm like, there's no possible way that that's possible. But I'm just kind of wondering because there's not enough hours in the day. So that must be an error on their part. But I'm just wondering about like MET hours of
Okay.
exercise kind of goals because it seems kind of like that kind of number crunches down like metabolism equivalent.
So for those of you that don't know, METs are a metabolic equivalent training, and they have different, like if you're walking versus rowing versus climbing a mountain, they give you different METs. And I can't speak to exactly what the recommended dosage is, but there is a link and I will send it to everybody. The recommended dosage in general of activity is 150 minutes per week of moderate activity. And that can be broken up into 10-minute segments. So you can walk in the morning for 10 minutes, and then you can go ride your bike for 10 minutes if you wanted, or you can do it all together. Or 75 minutes of vigorous exercise. So this is like running up a mountain or a HIIT class or something along those lines. That is the recommended amount for a normal person. For cardiovascular health, they've actually shown that we should double that pretty much. And there's some newer research out there that shows that if you do that, your cardiovascular changes are going to be a lot more. And so, as far as equivalents to METs, Jess, do you have any idea? Okay. Yeah, I don't know the exact equivalents, but like the ACSM has a great website that you can go on there and actually look at your minutes and put in your METs. And I think that handout that I gave you guys might have some MET equivalents on there. So I don't know the exact amounts, but I think you could probably do some equations and figure it out. Oh yeah. Okay.
I noticed. I didn't, but I noticed that. Like, oh, let's see that it had met out.
Oh, well, there you go. Uh, they were just saying here that a lot of the watches actually show the METs on it.
They show that.
Yeah. So I think it's more in regards to how much time you're putting in and what intensity you're doing it. And you could convert that to METs. I just don't have that conversion here in front of me. Does that make sense, Danielle? Okay. So real quick, touching on depression and anxiety, this is a huge topic that deserves hours and hours. we tend to get a lot more anxiety as you start going through perimenopause and into menopause. Menopause does not cause anxiety, but it does help. It does trigger it. So if you're predisposed to it, it can make things worse. We have a huge amount of sleep issues. So 40 to 56% post-menopause women have sleep issues. 46% at the age of 40 to 54, and 48% at 55 to 65. And these range from restless leg syndrome, sleep apnea, and insomnia. A lot of people just ignore these, but ignoring sleep apnea, if it's untreated, it will put you at risk 4 times more likely to have a stroke, 3 times more likely to develop heart disease. And so sleep is huge, and it's not something to ignore. And just know that it's not just something normal that we should deal with. Like, these are symptoms related to your hormone changes, unless it's something you've had all your life. Decreased estrogen decreases the uptake of magnesium, which can cause muscle cramps, hot flashes. Decreased progesterone decreases our ability to fall asleep and stay asleep. Insomnia treatment, cognitive behavioral therapy has shown great benefits. A lot of us don't have access to that. So other things like sleep hygiene, turning your phone off or screen off within an hour of bedtime, getting to bed earlier, not drinking alcohol right before bed, all of these things help. High intensity exercise and yoga also helps. Acupuncture has been shown to help. Diet, and then herbs have some evidence, things like melatonin and valerian root. Hormone therapy, low dose selective serotonin, or serotonin or norepinephrine reuptake inhibitors, or gabapentin for perimenopause can all be helpful. And like I said, this is a larger of a topic, but something to keep in mind. One positive thing, dark chocolate can be helpful to reduce depression and help with cortisol levels. So cortisol is that stress hormone that we have. The downfall of this is milk chocolate does not help and can actually make things worse. And if you drink milk with your dark chocolate, it negates everything. So no milk, just dark chocolate. A pound a day sounds wonderful, yes. And then anything that helps us relax. So meditation, there's some great research out there showing quotes, meditation, affirmations, mindfulness, movement, gratitude awareness, imagery, focused breathing, all this stuff helps us. And like I said, this is a huge topic. And honestly, if we don't address this, all those other things are not going to happen like we want them to. So if your cortisol levels are skyrocketed and your stress is high, it doesn't matter how much you're exercising, you're not going to get the benefits of it until you deal with some of this first. Okay. I'm looking at our time, and I'm going to skip over sarcopenia, which is the decrease of your skeletal muscle. Know that you guys are going to lose muscle no matter if you want to or not. Okay. When that happens, exercise helps, as does diet. Protein, especially with leucine, has been shown to help this. Leucine, taking 3 grams at 3 main meals together with 20 to 30 grams of protein is considered to be ideal to decrease your muscle mass going away. 3 grams of leucine in your food. And so a lot of protein has, if you look at like a protein powder, it'll tell you if it has leucine with it. There's certain foods that you can combine it with, and I will send a link to those as well.
There's a big push too recently I've been hearing about with muscle loss, that you can decrease it a lot by making sure your highest protein meal is your first meal of the day, which I thought was really interesting because I've done that completely backwards.
Yeah, and we're about to talk about that. So I don't know if you guys at home heard that, but making sure your first meal of the day is high in protein, and really every meal should have a significant amount of protein in it. Um, we things that we need more of uh, as our hormones change, we need more fiber. So 25 grams a day is needed. This helps to process estrogen. It levels out our insulin. It helps us stay full longer. Um, and these are things like ground flaxseed, whole grain bread, cereals, pasta, um, vegetables. You can get fiber additives, but this is huge. And the second thing is protein. And so 1.2 to 4 grams per kilogram of body weight is what is needed per day. And usually this equates to about, depending on your activity level, 20 to 40 grams per meal. Okay. And just diet in general, as our estrogen goes down, our digestion becomes more of an issue. Our cortisol levels go up. We get more allergies, so like sensitivities to glucose and gluten and lactate, all the yummy stuff we don't process as well anymore. It decreases our metabolism, and it changes that fat accumulation, so more of that visceral fat. It's shown that on average we will gain 5 to 15 pounds during perimenopause, and then another 5 to 15 pounds after menopause. Okay. And so we're going to talk about a couple different diets really quick, but an interesting study, they followed The Biggest Loser show, and they did a 6-year study, and it showed, for those of you that haven't seen The Biggest Loser, they do huge calorie restrictions and lots of exercise, and so they drop weight super fast. They showed that the weight loss slowed their basal metabolism, so that's your resting metabolic rate, and it made it adapt to a slower metabolism. And so most of these folks gained 2/3 of their weight back, and now they needed a larger calorie restriction to be able to lose weight again because their metabolism was lower. And so no matter how you try and lose weight, whether it's a diet or lifestyle change, slow and steady is the right way to do it. This is one reason why. I did read that we're supposed to chew our food more thoroughly, and they recommend 20 to 25 chews per bite. I think I do 3 to 4. So this is my new goal. But that alone could help a lot of us, I think. I think most of us are in a hurry. 20 to 25 chews per bite. Yes. Yeah. Yeah. It's much easier to digest. And you're less likely to swallow a bunch of air, cause gas, cause all kinds of gastrointestinal issues. Exactly. Yep. Yeah. Every benefit you can think of. Slow down. Prebiotics and probiotics help for this. A prebiotic is something that's metabolized by your gut bacteria. It's not a host human food. Example of this would be human milk. Probiotics are live bacteria, so active bacterial cultures like yogurt or something along those lines. And then symbiotics are a combination of both. And so this is a whole other conversation as well, but just keep in mind our guts change a lot during this time. And so fiber, protein, make sure we have pre and probiotics on board, and slow down and eat slower. That said, there are 3 different kinds of diets. Macronutrient diet is like the keto diet. So this is good for losing weight really quickly. And they've actually shown some good research as far as health benefits with it as well. You have to be careful if you have metabolic issues, but they've shown that it's hard to stay on, and so you're less likely to continue with that. Um, Manipulation of timing eating. So I wanted to touch on this because I feel like there's a huge fad of intermittent fasting that people are on board with. This basically switches your metabolic rate. So it's the thought is you're switching from burning carbs to burning fat. Um, I would be careful with this if you have any kind of insulin issues, any kind of disease processes. I would talk to your doctor about this. And I think where most people mess up with this is so, those of you that don't know what intermittent fasting is, it can be like you stop eating at, say, 7 p.m. and don't eat again until 10 a.m. the next day. That's not horrible in itself. That's just being mindful. Um, you still need the same amount of calories and you still need 3 meals with protein in it and fiber in it per day. And I think that's where a lot of people do this wrong is they just skip a meal altogether. And so they're only eating 2 meals and that can cause a lot of issues. There are benefits if you can get your 3 meals in that shorter time period. They've shown that it can help normalize leptin and insulin sensitivity. It can reduce inflammation and free radicals that we talked about. It reduces triglycerides and helps with memory. It can improve biomarkers for disease. Average weight loss is about 4 to 10% over 4 to 24 weeks for an obese person. But it also can increase your cortisol levels. So we already said that these stress hormones are a little bit higher, and if you're depriving yourself of that, it can affect that. And also, if you're active, you're not giving your body the proper nutrients when it needs it. So there are things to consider. It's right for some people, but I would certainly talk to your doctor before you do it. Yeah.
Especially for women. Like that's
Yep. So the question was about skipping breakfast, and that's the thing is there is no like one thing does not work for everybody. But in general, breakfast is the most important meal of the day, and that is number one because it gives you your energy for the day. But I keep going back to the cortisol levels, all of your androgens and everything. Those are highest in the morning, and if you don't get the nutrients that it needs, it holds on to that and keeps those higher. And that can affect your metabolism. It can affect how you're burning your fat. And so, for most people, eating breakfast within an hour to 2 hours of getting up is essential. And that's hard for a lot of us, but something to consider. The other kind is restriction of certain kinds of food. So vegetarian, plant-based, gluten-free diets, paleo, that kind of thing. And then the Mediterranean diet. And out of everything, they've shown the Mediterranean diet has the greatest benefits for cardiovascular health, and you're most likely to stay with it because it is the least restrictive. So it is basically like eat vegetables, fruits, nuts, seeds, legumes, breads, whole grains. In moderation, eat poultry and eggs, cheese and yogurt. Eat rarely red meat, and then avoid added sugar. So soda, candies, ice cream, refined grains, so white bread and pastas, trans fats, canola oil, things of that sort. Processed meat, so like hot dogs and sausages, and then pretty much anything processed. It says low fat or diet. It looks like it was made in a factory. Avoid it. And so, I mean, this is basically it's your balanced diet for the most part, with a little bit more restrictions. And so, all of the research out there shows that this is probably the best route to go if you are looking for a diet that is helpful. Otherwise, I would say make sure your meals are colorful. Like add in as much color as you can. Limit your sugar and processed food. And there is a website called myplate.gov that will walk you through what each of your meals should look like and how many calories you should have and all that. And it does a pretty good job of it. Okay. So I know we're short on time. Real quick, physical activity. We talked about 150 minutes of moderate intensity, 75 minutes of vigorous intensity. This is most days of the week. And then we should be combining that with muscle strengthening. So this would include most major body parts. So your upper body, your lower body, your core, 2 or more days per week. And as we get older, that resistance training and power training becomes more and more important for our metabolism, for everything. We respond less well to some of that cardio exercise that used to help us lose weight or feel better, and the resistance training becomes more and more important. Real quick, sedentary behavior is distinct from physical inactivity, meaning you can get 150 minutes of physical activity in a week, but then if you go and sit at your desk for the rest of the day and don't move, you're still considered sedentary, and that puts you at a higher risk of heart disease and mortality. And so if you are stuck at a desk or something that is not active, make sure that you guys get up often. Just get up and move whenever you can. It makes a big difference just walking to the back. And then exercise in general reduces our risk for hot flashes. Other side effects of menopause, it decreases the risk of osteoporosis, cardiovascular disease, sleep disturbances. It improves our mood and quality of life. It can help with mental clarity, improves strength, power, balance, and it helps with regaining bone loss. So I'm a huge proponent of exercise. And obviously, one of these modes is not going to be enough by itself. So we need to look at nutrition. We need to look at our mental health. We need to look at all of these factors. But this is an easy one to start to incorporate in, even if it's just going for a 10-minute walk once a day. Like, start small and start doing more. I have a whole section on hormone replacement therapy, which is a huge topic. Just super quick, and then anyone that wants to stay after can come pick my brain. But like we said, it's not for everyone. If you have some of those issues that we talked about that go hand in hand with perimenopause, and you don't have a history of breast cancer or ovarian cancer, please go talk to a healthcare provider and see if this is helpful for you. It's not something you have to do. There are differences. There's systemic versus topical or site specific. So a systemic would be a pill form that you take, but there's great evidence in, like, when you have vaginal wall changes, having topical estrogen for that area. You can be on this long term, and it works so much better than antibiotics for UTIs. They are actually talking about making the standard for in nursing homes for older women that are getting these recurrent UTIs. A lot of it has to do with the amount of estrogen. And it doesn't have to be systemic. It doesn't have to be floating around in your system. It can be site specific. And you can do estrogen site specific creams for your face. So we start to lose our collagen. Things start to, gravity sets in. There can be specific areas that you target that doesn't have to be a systemic hormone replacement therapy. Testosterone can help with sexual function and libido. It can help with muscle and bone loss. Progesterone can help with sleep big time. And definitely all the studies are showing if you do estrogen or estradiol, doing that with progesterone is important just because it helps to thin our uterine walls, and it's less likely for you to develop any kind of cancers or side effects. And then I have a lot of research on the side effects associated with this. So if you are postmenopausal and you have a uterus still, estrogen and progesterone therapy together The incidence of a coronary event is 7 in 1,000 females. A stroke is 1.2 in 1,000. Breast cancer is 3 in 1,000. Gallbladder disease is a little higher, 60 in 1,000. And so when you look at studies of just normal people, that incidence is not very high. And so I think, the studies that scared us a lot before, we don't need to be quite as frightened away from them as we were back then. Okay. I talked a lot. I have a handout for you folks at home that have kind of some pearls of everything we talked about, along with some handouts. I will email those to everybody. I am going to open this up to questions and thoughts, and people are more than welcome to scatter out of here. I will send any handouts that we talked about along to you guys.
So the estrogen, are those something that a doctor would have to prescribe?
Yes. Yeah. So even topical is a form of hormone replacement therapy. Even birth control is a form of hormone replacement therapy. They're just different forms. I do not. It is my hope that this will change. I have been, I've talked with Dr. Edwards a little bit, and I think people are getting more educated in a lot of this stuff. I know there's some folks that I've talked to that use virtual people that are outside of Sitka, but I can't say that there's anyone well versed in it as of right now. It's Dr. Babb. Okay. Yep. So I'll leave it at that. Right.
Hi, can you hear me?
Yeah, Christy, hold on one second. A little bit, but so at home we were just discussing hormone replacement therapy has only been shown to be beneficial for hot or FDA approved for hot flashes. Like I said, a lot of this research is new, and they, like I said, if it were clear, they would be recommended. It would be FDA approved. It would be the American Medical Society would be recommending all of this, and so a lot of it is still kind of up in the air, and a lot of that is because we're all different and it affects different people differently. And so to find a general physician in town that is well versed in this, they were talking about even OBGYNs, they get a max of about 8 hours their entire medical career on menopause. And doctor and a general doctor gets about an hour of their entire medical career. And so you guys have got more knowledge than a lot of people. And I mean, so it's partially on us to be proactive, and it's not that I think a lot of people would be very open to this. It's just they haven't had the chance to see some of the newer research, and like I said, it is still changing. Yeah, Becky. Oh, the other Becky. Yes, I do a little bit. So the question was natural herbs and in different forms. So with hormone replacement therapy, there is like estrogen, progesterone. And then there are synthetically derived ones as well. And then there are natural occurring things like ashwagandha. They have been shown to help a lot of the symptoms, especially things like anxiety, depression, that kind of thing. The research behind it is not so, like the course I just took, it's very heavy on research backed everything. And so there's not very much research
Can
to
you
back.
smell that?
Yeah, and it doesn't mean that it's not helpful, but I will say, I think they talked a lot about the fact that that study back in the day scared people off of hormone replacement therapy. And so a lot of naturopaths and alternative care providers started recommending things that are more herbal based. And the the discussion that was had was they don't they're not as beneficial because it's not addressing the exact thing that we are lacking. And why are people getting pushed that way? If it's that what you is what you decide you want to do, then that's great and it could help with some symptoms. But it's similar to like the antidepressants. Like that shouldn't be the first thing that we suggest to people because that's not what is necessarily lacking in your body. Yeah. Yam cream? Do you say yam cream? I would assume because it has, yeah. It can be helpful. So it's a form of hormones, right? Progesterone usually. And so it can be helpful for bone protection. I don't know. I don't know if it's negative early on with like prolonged use. I don't think that's what I said, but it could be. Okay. Yeah. So that was up at cardiovascular risks. The question was regarding oral contraceptives and yeah, so I
But my question specifically to that is it like current use and effect or like as it needs?
let me get back to you on that because it should decrease your risk, but I want to make sure that I'm well, and same thing with hormone replacement therapy, like, you know, 10-year span at the right age can be helpful. If you go past that, it can actually be harmful. And so I would assume that might be truthful with oral contraceptives as well, although there's no position stance on that they are harmful at all for us. So, yeah. Sorry, Christy, I know you had a question.
Okay, can you hear me?
Yes.
Okay. Not really a question, just more of a request, I suppose. It would be really wonderful because perimenopause and menopause literally hits so many systems in our bodies and our mind too, and our psyche. So much. There's just so much. It would be wonderful if we could have another couple of talks on how to be proactive and the prevention piece. I think nutrition is huge, huge, huge. That would be really awesome. I'd love to get more information on, how do I support myself through this nutritionally. So anyway, just wanted to throw out that as an idea for you if you're bored.
Thank you, Christy. Yes. Well, thank you for leading into that. So, I think I'm passionate about this topic, and I want everyone to have the knowledge. That's part of why I gave the free talk. Um, I do have a monthly wellness group that meets, and like I said briefly, we have guest speakers that come in. So we had a nutritionist come in and gave a talk 1 month and went into a lot of these details. Um, and these talks are associated with that. I think it's a great resource, and the idea is to give a more like holistic, full body approach to our health. Um, that said, this is also my business, and so I do offer these services as far as like coaching and one-on-one and these wellness groups, and so I will definitely consider doing another talk, but this is stuff that I'd be happy to help you with as well if you ever wanted to make an appointment. I will send this out in an email as well, but anyone here does get 50% off a initial visit with me. So if you ever did want to follow up, whether it be traditional physical therapy services or wellness services or anything directly related to this and starting an exercise program, you do get 50% off. So my little
Thank
plug.
you.
Yes.
Yeah, thank you. And then I would be even willing to pay for like a series. If you did a series on this particular topic, one of them could be about mental health. The next one could be about nutrition. The next one could be about, but I didn't even think about my bones. I mean, and I felt like I knew a lot about this topic because I've been studying it a lot, but I'm like, oh my God, now I got to think about my bones too. Crap. Anyway. So I would be really into like paying for a series if you wanted to do something like that. I appreciate this one being free. Thank you so much. You're awesome. But yeah, I would pay for something like that. Just to let you know.
All right. I will keep that in mind. Well, thank you guys. I'm going to go ahead and turn this off. I'm here after if you guys want to come talk to me. And feel free to, I will send out the email. If you guys have follow-up questions, you can always shoot me an email. I'd be happy to answer if I can. Well done. All right. Thank you guys.